Peyronies disease, and what it is and why men suffer in silence. If you notice a curve, a bend, or a hard lump in your penis and you haven't told anybody about it, you're not alone. Peyronies disease is one of the most common conditions I treat, and it's almost certainly the most under-discussed. In this episode, I'm going to explain what it actually is, what causes it, and what most men are told, and what they're not told. I'm Steve Carter. I'm the founder of Male Health Clinic here in Beeston, Nottingham. I specialise in men's intimate health for several years, and Peyronies disease is something I see every week in clinic. Peyronies disease is a common a condition that is where fibrous scar tissue called plaque develops inside the penis. This plaque can cause the penis to curve, bend, or in some cases develop dents or indentations, a bit like an hourglass effect. It can also cause pain, particularly during erections, and in some men it leads to difficulty with penetration. It's not a cancer, and it's not sexually transmitted, and it's not the result of anything you have done wrong. The exact cause isn't always clear, but it often follows a minor injury or repeated microtrauma to the tissue, sometimes during sex. And many men don't even remember a specific incident. The condition develops gradually over several weeks or even months. It affects somewhere between 3 and 9% of the men, though the true number is likely higher because many men never seek help. One of the biggest challenges with Peyronies disease is that men tend to sit on with it for a long time before telling anybody. There's an embarrassment. There's hope it will go away on its own, of course. And there's often a lack of awareness that anything can actually be done about it. In my experience, many men come in after 12 to 18 months after dealing with this privately, by which point the condition has progressed further than it needed to. The earlier the treatment is started, the better the outcomes tend to be. That's not a sales message, this is just the clinical reality where the evidence supports. When men do go to their GP, they're often told two things: that surgery is the real option, or that just sit and wait and see if it stabilises. What most men aren't told is that non-invasive treatment options exist, and that for many men, those options produce meaningful improvement without surgery, without any medication, and without any significant risks. Focused Shockwave Therapy has growing evidence based specifically for Peyronies disease and that of erectile dysfunction. It works by breaking down fibrous plaque tissue and stimulating the body's natural repair process and increasing blood flow. It's not a single session. It requires a course of treatment, but for many men I've worked with, it has produced real, measurable change. If any of this sounds familiar, whether you've just noticed symptoms or you've been living with this for a while, please don't sit on it. The earlier you understand what's happening and what your options are, the more options are available for you. Subscribe below for more honest content on men's health issues. And if you'd like to talk through your own situation, we offer a free informal chat at Male Health Clinic, where the link is in the description below.